The Heart of Healthcare, an introduction to UK nursing. This chapter will take you through the essential aspects of nursing in the United Kingdom, highlighting the dedication and commitment of those in the profession. Nursing is more than just a job, it is a calling. It requires a deep sense of empathy and a genuine desire to help others. It is about providing care, compassion, and support to those in need. Nurses often become a source of comfort and strength for patients and their families during challenging times. In the UK, the nursing profession is deeply intertwined with the National Health Service, or NHS, which provides healthcare to all residents. The NHS is a public service that has been a pillar of British society since its inception in 1948. The NHS is a cornerstone of British society, ensuring equitable access to healthcare. It operates on the principle that good healthcare should be available to all, regardless of wealth. Nurses form the backbone of this system, working tirelessly to deliver high-quality care. Their roles are diverse, ranging from direct patient care to administrative duties in specialized medical procedures. From hospitals to community clinics, nurses are the first point of contact for many patients. They play a crucial role in the initial assessment and ongoing care of patients. Understanding the NHS and its values is crucial for aspiring nurses. This knowledge helps them align their practice with the core principles of the NHS. It is a system built on principles of universality, equity, and comprehensive care. These principles ensure that every patient receives the care they need when they need it. These principles guide nurses in their daily practice, ensuring patients receive the best possible treatment and support. Nurses work collaboratively with other healthcare professionals to provide holistic care. To safeguard both patients and the profession, the Nursing and Midwifery Council, or NMC, exists as a regulatory body. The NMC ensures that nurses adhere to strict professional standards. The NMC sets standards for education, training, and conduct, ensuring all nurses meet the highest professional benchmarks. This regulatory framework helps maintain public trust in the nursing profession and ensures the delivery of safe, effective care. Navigating the NHS structure and patient care pathways. The NHS is a vast and complex organisation, but understanding its structure is key to navigating it as a nurse. This knowledge helps in providing efficient and effective patient care. It is divided into primary, secondary, and tertiary care levels, each with distinct roles and responsibilities. Primary care forms the first point of contact for patients, often through GPs and community nurses. They handle general health issues and preventive care. Secondary care involves specialized treatment in hospitals, where patients are referred for more specific medical attention, while tertiary care handles highly specialized cases, often requiring advanced medical technology and expertise. As a nurse, you might work within one or across multiple levels of care, adapting to different environments and patient needs. Understanding patient pathways, the journey patients take through the system, is crucial. It involves knowing the steps and processes patients go through. It ensures smooth transitions and coordinated care, minimizing delays and improving patient outcomes. For example, a patient with a suspected fracture might first visit their GP, which is primary care, for an initial assessment. They may then be referred for an X-ray and consultation with an orthopedic surgeon, which is secondary care, for a more detailed examination, and potentially require physiotherapy during recovery, which is community care, to ensure full rehabilitation and support. The NMC, your guide and guardian in nursing practice, dedicated to upholding the highest standards. The NMC acts as both a guide and a guardian for nurses throughout their careers, providing essential support and resources. It sets the standards for nursing education and practice, ensuring all nurses are equipped with the necessary skills and knowledge to deliver exceptional care. To practice as a nurse in the UK, you must be registered with the NMC, which is a crucial step in your professional journey. This involves meeting specific educational requirements, passing a rigorous registration exam, and adhering to the NMC Code of Conduct. The NMC Code outlines the professional standards expected of every nurse, guiding their daily practice. It emphasizes patient-centered care, dignity, respect, and the importance of maintaining professional boundaries, ensuring the best outcomes for patients. The NMC also plays a vital role in investigating concerns about a nurse's fitness to practice. addressing any issues promptly. This ensures patient safety and maintains public trust in the profession, reinforcing the integrity of nursing practice. Diverse roles, shared values, the landscape of UK nursing. Nursing is not a one-size-fits-all profession, it is incredibly diverse. There are numerous specializations within the field, each requiring a unique skill set and knowledge base, from adult nursing to mental health nursing, pediatric nursing to learning disability nursing. The options are vast and varied. Each specialization focuses on a specific patient population or healthcare need. Despite the diversity of roles, certain core values unite all nurses: compassion, empathy, commitment to patient well-being, and a dedication to lifelong learning are paramount. Furthermore, effective communication, teamwork, and critical thinking skills are essential across all nursing specialties. These qualities enable nurses to provide the highest quality care in a complex and ever-evolving healthcare landscape.